In terms of apologies, we have 3. Brenda Hale, Jimmy Spratt and Alex Atwood. Have we any others or late arrivals to note? Okay.
It'll be late.
Hey?
Megan will be a bit late.
Megan will be a bit late. Thanks, Alex. Last week, members, the clerk and I met with a number of organisations in relation to refugee and asylum issues, which we mentioned. On page 5 of your pack, there's a clerk's brief, and beyond that, some papers on Refugee Week, and also papers in relation to the Department's emergency fund. The representatives are seeking assistance from us on 5 issues. Number 1 is support the prompt implementation of the OFMDFM Crisis Fund. Number 2 is to commission research from the Assembly Library and Research on refugee issues here in Northern Ireland. Number 3, request the Department prioritises the Refugee Integration Strategy and Action Plan, including the provision of adequate resources. Fourthly, support Refugee Week 2014, which is in June, between the 16th and 22nd. And finally, to consider the issue of communication with the Home Secretary on asylum issues, because they remain the responsibility of the Home Office. If you then go to your tabled papers on page 3, the clerk's prepared a paper with some suggestions for how we might respond to these 5 points. Can I ask broadly, are we all content that it's an issue that we want to look at and in principle be supportive of?
Yep.
Stephen, happy?
Yep.
Yeah. Maybe we should go through the tabled paper at page 3. You can see it was the 3 bodies who came in to speak were the Law Centre, NI, Red Cross, and the Northern Ireland Community of Refugees and Asylum Seekers, NICRAS. So at 1A, support the prompt implementation of the Crisis Fund. You'll see some quotes there from various extracts, and over the page at page 4. Potential action is to write to the Department to seek further information on the timeline for this fund, what budget might be put against it, and the governance and eligibility arrangements. Content with that? Mm-hmm. Great. Okay, then research. We could commission a paper to try and quantify the number of asylum seekers, where they've come from, length of time they've been here, all the kind of basic raw data that might be useful. Great. And again, it's because it's Home Office, it's very difficult to access from an existing source, a regional data set. So are we content? We'll ask Library Services. Great. Mm-hmm. Thank you. Number 3 was prioritise the Refugee Integration Strategy and Action Plan. This may need to be considered in a wider context of racial equality strategy. Could I suggest we might write to the Department and ask for their views on where it fits?
Yep.
Yep. Mm-hmm. Okay. Next we have Support Refugee Week between the 16th and the 22nd of June. We could table a motion for debate in the Chamber on the Monday, 16th of June. And you can see at the bottom of page 4 there's a draft, potential draft motion there.
Chair, just in relation to Refugee Week, I don't know really what it means. What does Refugee Week mean?
Mm-hmm. Well, I think
we advocates on behalf of.
Mm-hmm. I think if it's in the electronic part of the pack, Stephen. Let's see if we can deal this up.
It's generally like awareness raising, with showcase different cases. It's been on the it's been launched up here every year for several years.
Okay. Hey, page 7, Stephen, if you have the pack to hand?
Yes.
Page 7, we've got there are 5 bullet points. Developing and promoting stories and activities that explore how young refugees perceive their futures. Highlight the importance of welcoming, protecting and supporting refugee children and young people. promoting refugee children and young people as key players in educating their peers, celebrating the contributions, and highlighting the brilliant services that support young refugees. So those are.
I'm content with that.
Yeah.
That's the nature of
Okay.
it. Thank you.
Fair comment. Yes.
I would fully support that. Just a point of information as well. Memory serves me correct, that is also Community Relations Week. So just as point of information to consider whether that impacts whether we should be doing something for that as well in addition, or whether it's something that we've covered previously and that's adequate. But just point of information, I'm pretty sure that's Community Relations Week as well.
When would we need to put a motion in?
By the meeting of the 28th.
The meeting of the 28th?
If
So-
you wanted to do it on
So
the
we've time,
16th.
we've time to check. If it's Community Relations Week, which Chris seems to think it is, pretty sure he's.
I think so.
Did you want to change the wording of that motion?
So members, if it coincides with Community Relations Weeks, would we want to change the motion to acknowledge that it is also,
Yeah. So we're trying to merge both, maybe?
but keep the primary focus on
Yeah.
Refugee Week? But then it would be open to any member
Bring the other one.
to speak to either or both,
Yeah.
weighted
Chairman.
as they see it fit.
As your brief helpfully sets out, I think the theme for Refugee Week is shared future, so I think there would be a way to logically combine reference. Yeah.
So if we bring back a motion for the 28th, meeting on the 28th, which acknowledges that they're both happening and is worded in a way that any member can weight their comments to one or the other as they wish. Yeah. Okay. Thank you. And the fifth and final point, members, was the role of the Home Secretary. You'll see there's an exchange there from the Racial Equality Strategy meeting here at the 12th of March between Mr. Maskey and Mr. Fraser from the department. What I was wondering was whether we want to write to OFMDFM to see what interaction they've had with the Home Office on regional immigration issues. And also, I was wondering whether this would be a fit subject for the British Irish Council, because if we have difficulty being involved, and Wales, Scotland and the rest may have difficulties in terms of accessing the Home Office. I mean, I know I've as an MLA had people come to me and I can't write, or I can write to the Home Office but they won't acknowledge it because I'm not an MP.
That's correct. Yeah.
Is there a route here for our MPs? Because I know our own MP, Michelle Gildernew, would deal, quite a bit.
Yeah. It's a question, as a problem, do we want to have a formal route in, or is everybody content to go through members of Parliament? I mean, I think there might be some advantage in exploring whether there was a contact point, say, in the Home Office for devolved elected representatives.
I think probably the best way of dealing with it then would be through the executive. You know what I mean? In the first instance, at least, ask the executive if they made representatives on behalf of the rest of the representatives here.
And they could bring it to something like the British Irish Council.
So they need to bring it direct to the Home Office in the first case, I suppose, but whatever, you know what I mean? So in the first instance, I would suggest we go to the executive.
Well, I was suggesting we write to OFM, DFM, as a first protocol, and then bring it back.
Yeah.
Okay. Okay. Thank you very much. I think that's that. Okay. So you bring back a motion for the 28th. Okay. Next, members, page 38 is a copy of the committee's current invitations. Just to note, the Assembly and Business Trust, their event, What Does Europe Mean for Business, has changed. It's now starting at 5 p.m. On the 13th. That's back an hour from the original 4 o'clock start. Next is the draft minutes of the meeting of the 30th of April, and unusually, members, these are on page 8 of your tabled papers. So I'll pause for a moment just to give everybody a chance to reflect on those draft minutes. Are members content, or do you need a little bit more time?
Content.
Happy enough, yep.
All content? Thank you very much. Item 4, members' matters arising. Page 41 of your electronic pack, you'll find a response from the department giving us further information on the Social Investment Fund, and this is on foot of the briefing of the 19th of February last. The response includes a list of the projects within the area plans which the department hopes will be affordable as it continues to work through economic appraisals. Any comment, members? This is the most robust list of what's actually planned on the ground that we've had to date, zone by zone. In the absence of comment, we shall note. Okay. Page 58, a response from the department giving us further information on the role of the Strategic Investment Board in supporting the Strategic Investment Portal, and also on the current situation with OFMDFM information held on that portal. In the absence of comment, are members content to forward this response to the Committee for Finance and Personnel, who are the body coordinating scrutiny of this? Great. Thank you. Next, page 62, a response from the department which gives comments on a research paper provided by the Committee for Finance and Personnel on financial transaction capital. And again, if there is no comment, are members content to forward to the Committee for Finance and Personnel and to Assembly Research and Information for their information? Okay, page 65 is next, members. This is a response from the department which provides further information on the implementation of recommendations from the review of the Victims and Survivors Service, as well as providing information on the gap funding following Piece 3, and thirdly on the process for self-certification. At page 67 you'll find Annex A, and you may find this more than useful during our oral briefing session from the Board of the Victims and Survivors Service. I'll pause in case anybody wants to comment at this stage, but it might, I say.
Yeah, Chair, I'm sure it'll come up in the discussions, but just the gap in the funding, the response says that the Victims and Survivors Service has been asked to produce a paper for the Victims and Survivors Programme Board regarding the impact of cessation of Piece 3 funding. However, it is essential that expectation of groups are not being raised. It's my understanding that groups find themselves in a pretty dire situation in terms of funding extremely soon to run out, and had received some reassurances that the February or January monitoring round in particular may have resulted in additional funds, and are now being advised that that wasn't the case and is not going to be the case. So I presume we'll get an opportunity to draw that out, but just wanted to bring that to the attention of the committee if it wasn't already.
Okay, thank you. I also note in terms of the self-certification that was brought in that has now been stopped. And we have quite a detailed implementation plan for the implementation of independent assessment recommendations. And from my point of view, I think the very right-hand column progress update is informative, not overly encouraging, I have to say, and that I don't think there's anything that's actually been completed. Seems to be partially completed. There's also pending confirmation and delayed. Okay, page 93 of your pack, members, outstanding correspondence. And once again, once again, members, the list has shrunk dramatically, and that's once again to be welcomed. One issue I would like you to perhaps give me your thoughts on is the second one down, date issue 20 June 2013. It was a request for assessment of support services provided by the Historical Institutional Abuse Inquiry, and we invited Savia, Wave and Lifeline to respond. Wave and Lifeline have responded. I understand Savia have been asked on multiple occasions for their response. Do we go forward at the speed of the slowest? In other words, do we wait potentially forever for Savia? Or do we press on?
Press on, I think.
Well, I think, Chair, I mean, we have certain rights, haven't we, to request this information? So are they been obstructive, or do they not have it, or what's the problem?
Well, I mean, my understanding of Savia is that they came about specifically as a support group because of the institutional abuse, would not be funded in any significant way, and therefore I would imagine it's more a resource issue, capacity issue, than any kind of disrespect or...
Press on then, Chair.
Well, could I suggest we write to Savia and say we are pressing on,
Yep.
so this is a hard deadline?
Yep, sensible.
Yeah, okay. Thank you. On to correspondence then, page 96. Correspondence from the Committee for Finance and Personnel, providing the provisional timetable for the Executive's in-year monitoring rounds. Departmental returns for June 2014 are due on the 5th of June, and we have a briefing scheduled for 28th May, as yet unconfirmed. Page 98, April's monthly update on delivering social change, which is sent out by the Department to stakeholders. Then at page 100, details of the Department's consultation events in relation to the draft active ageing strategy. Page 102, a copy of the Department's investment strategy investing activity report for the month of April. And then moving to tabled items at page 6, a letter from junior ministers inviting the committee to a round-table event which is taking place actually on a Wednesday afternoon, Wednesday the 14th, next Wednesday, from 1 to 3, upstairs in room 115. The topic is disability-inclusive policy and practice-the Massachusetts model. The letter also requests that the briefing from officials scheduled for next week on delivering social change is postponed until 4 o'clock, as the officials are involved in that round table event upstairs. What I would propose, if members are content, is that we accept the invite and knock back the start of the committee meeting to 3:30.
Late enough.
I think given difficulties we've had previously with non-invitations and not being informed of events, now that we've been given the invite, it would be...
We've made progress. They're inviting us. Just happens to be at the exact same time as our committee meeting, I suppose. But yeah, progress, Chair.
Yeah, okay, yeah. I mean, I think in fairness, the schedule of the agenda next week is not going to keep us here till late.
Substantive item.
With one substantive item, so all
Chair,
content.
I've already given my apologies for next week, so I'll not be here.
Right, okay. So we're all content. Okay, thank you. Okay, members, we're into our oral briefing. This is about victims and survivors. We have a briefing from the Victims and Survivors Service, specifically on work undertaken following the review of the service. So in terms of information, at 106 in your packs, you'll find the clerk's brief, which provides some background. Beyond that, the Victims and Survivors Service briefing paper, which provides a summary of actions undertaken since January 2014, is at page 108. Advice from the Commissioner to OFMDFM is at page 110. The independent assessment reports by WKM Solutions and by SIPFA begin at page 117. Then at page 183, you'll find a chronology of events leading up to the independent assessments. And the terms of reference for the assessment, page 184. And at page 186, Hansard from the briefings of the 5th of March at this committee. And just to remind you, members, working backwards to page 67, that's the start of that implementation plan we noted earlier on. We've also tabled pen picks of the board members for your information at page 16 of your tabled papers. So we welcome Peter Gay, who is the chair of the board of the Victims and Survivors Service, Anne Dorby, who's chief executive, and Oliver Wilkinson, who is a board member. Peter, could I ask you to make some opening remarks?
Yes, thank you very much. Well, good afternoon, Chair and Committee. I'd like to thank you for inviting us to come before you today. As you know, we were appointed in December, and we've been working very hard since that time to get to know the work of the service, get to know the stakeholders, and also to work with the recommendations that have been made as a result of the 2 reviews that were commissioned by the Commissioner. You'll be aware that those reviews made 70 recommendations. As a board, we welcome those, and we have committed to implement all of them and implement them enthusiastically. There were, as I say, 70 of those recommendations, and we do believe that they were accurate, they were fair, and recognising the changes that had started but needed to go on. Already 29 of the recommendations have been totally implemented. There are 23 that are partially implemented, by which I mean that they are implemented but have not been signed off by the board. Our board meets next Monday and we will sign those off then. There are 7 that are delayed, and those relate to the individual needs review, which I'll talk about later, because that's going through a process of development at the moment. And there are 11 that are pending confirmation and will come through end of May, end of June, and into the summer. So that's where we are with those. I want to say that the board is committed that the VSS will be a person-centred organisation. We want to ensure that everybody gets the same high standard of service wherever they are and however they come into the service. And it's our commitment to do that, and I'll say a little bit more about how we're doing that later. One of the key things that came out of the review was the revision of the individual needs review and replacement of that by something else, which is called the General Needs Review in early February. What the Commissioner's reviews were saying to us was, you need to make it easier for people to come into the service. You need to reduce the barriers, you need to open more opportunities for people to come in, and you need to make it much more user-friendly. And as a board, we took that completely, and we designed on a temporary basis this process, which is known as the General Needs Review, and not only implemented by the service itself, but by the groups with whom we work. And that has had a big impact. That has had the result, in a short period of time, it has enabled something like 2,000 people to come forward in order to receive support, which is a very large number when you consider that we had something like 3,500 before. So we're talking about large numbers of people coming forward. And when that happened, as a board, we realised we need to be sure that everybody who is coming forward is going to be reviewed so that we are clear that they are fully eligible under the terms of the order. And so we decided there would be a 100% checking of eligibility, which the service is doing, and that is taking its time. So out of the 2,000, 900 have come through the assessment so far, and of those 900, the vast majority it is very clear that they are indeed eligible as victims. In fact, less than 1% do we say we don't have the documentary evidence to say that they are victims. So this is very interesting that this new process has encouraged many more people to come forward. But it has also created a massive amount of work for the service, and the service has been working long hours, and indeed in some cases working weekends, in order to try to work through that very large number of applications. I want to move on to talking about the service working with people in the sector as a whole. and report to you that with the kind support of the Commissioner, with whom we work closely, the board were enabled to meet representatives of all of the boards of the groups that we work with. And we had a large event, and we wanted to have information sharing, we wanted to have consultation, we wanted as a board to be accessible to them, for them to get to know us as people and us to get to know them as people, prior to a program, a rolling program over the year of going out and visiting all of these victims groups right across the country, and that's something we're committed to doing. At that meeting, we talked about eligibility. We discussed that with them, and I will say there was quite lively discussion about it, but I think there was a consensus that it's really important that the service ensures that everybody who registers and is recognised by the service is actually eligible, and that is something that we are doing and is recognised as important. We also talked about monitoring and evaluation, because we need to be accountable for public money. We need to know how that money is being used within the groups and what impact it is having. And so we engaged in discussion with them about that. And I think we are in the process of putting together a final approach to monitoring and evaluation, which will then be something that the Commissioner will comment upon. I mentioned that we are in the process of going and talking to boards of groups and also staff of groups. We're already engaged with that. 4 of those meetings have already taken place. I've been out to visit one of the large ones, WAVE. I've got a plan to go out to meet all the groups in Oma this month. My colleague Oliver has been to visit others in the northwest, and another colleague, Bertha McDougall, who some may know, has been doing that in the south and the southwest. So we are getting out and about and making ourselves known. I mentioned the gateway process. It was only intended to be a temporary measure, because you will have read the reviews, and the reviews talked about the importance of a triage approach, an approach which would do 3 things really. One is identify whether somebody is eligible. 2, identify what their needs are so that those needs can be met. And then the third thing is really to ensure that that is implemented and implemented well. So that's what we're doing, and part of that implementing well, I have to say there are people who come to the service and they do have psychological needs, and there are people who come to the service and they have mental health needs. And what we're concerned about is that those needs should be met. Now, we're not talking about us as a service meeting them ourselves, but we are talking about ensuring that they are met through the provision of the health service. And we see that we have a role in signposting, but not just signposting, but in actually helping people to access the service. And I think it's probably known to you that at high level, in the department and at ministerial level, there have been discussions between the OFMDFM and health about how that might happen. Protocols are being worked on and being prepared, and I know some high-level documentation is being analysed today on that. But that's at high level. At our level, what we're concerned about is ensuring that if somebody comes to us and they are distressed, and they do have psychological needs or mental health needs, that we have an intelligent conversation which recognises that, and that we're able to see to it that those needs are addressed. So that's what we want to see happening. And what we have been working on within the service is developing a replacement for Gateway, which is only ever meant to be a short-term thing to ensure that nobody was left out. And we call this a health and well-being review. We have prepared it. It is at the moment with the Commissioner. There are meetings which will happen next week, and we hope and believe that we will very soon be able to introduce that. And it will be, in our view, a better and more appropriate system than the one we have at the moment, and it will be fully compliant with that as recommended by the reviews, the Commissioner's reviews. Another area I want to mention is the Victims Forum. We are committed to working closely with them, and we want to listen to them, we want to learn from them. And we have made a decision as a board that every time there is a meeting with the service, between the service and the forum's representative group, there will always be a member of the board who will be there. And that's partly to say to people, we are here as a board, we're not remote from you, and you can talk to us and we will listen to you. And it's also so that we as a board have a closer and better understanding of what their needs are. So we're talking about working closely with groups, we're talking about working closely with the forum, and then working closely with the Commission, and getting a good, strong, collaborative relationship with the Commission. I personally have been working hard on that. I think have developed a very good relationship with the Commissioner and also with key people in OFMDFM. And that's essential if issues that arise are going to be dealt with quickly and effectively. And that's what we want. We don't want to see them going on. And you'll know that on the programme board, which is actually meeting today, there is a member of the Victims Forum Services Working Group, and that's a very useful thing. I'm aware that the committee and the Commissioner have raised concerns in the past around communication, and we're aware of that in the board. We know it's something that needs to be improved. We have asked the staff of the service to prepare a communication strategy. They have prepared it. We have approved it, and it is being implemented, and it's on our board agenda every month that we're asking the executive to tell us how this communication strategy is being implemented and what effect it's having. What is the impact of it? And how is it that the message is getting across to people, and we are in turn listening to what people are saying to us? Because we believe that feedback from those whom we serve is really important, and we want to hear it. We're not only open to it, we want to hear it. I do want to say that we have a call management system which is needed to have been improved. The committee will be aware that there have been times when people have had difficulty getting through to the service. One of the things we realised as a board was that the telephone system was quite antiquated, needed to be replaced with something that was much more fit for purpose. And we have implemented that. But having a good system is one thing, but it's equally important, if not more important, to have people who are going to answer the phone in an empathetic and human way. And that's why we have insisted upon training for all staff in knowing how to do that, and recognising that sometimes when a member of staff is dealing with a victim, that it's not an easy conversation, that the individual can be under stress, they can be emotionally upset, they can be angry, and we recognise that VSS staff need the proper skills to be able to handle that, so they don't get emotionally distressed themselves, and that they're able to be of genuine support to the person. So we have put that in place. And also, because we anticipate that over the next few months there's likely to be a very large increase in the number of calls, we have put in place some flexibility so we can bring in people who are trained and that will be able to answer. And so we don't ever want to be in the position where people are finding they can't get through to us. I mentioned feedback, and I also should have said that we have a complaints procedure. The board has been very active in looking at that and ensuring that the results of the complaints procedure are reviewed at every meeting. And I'm happy to say that in the short time that we have been here as a board, we are starting to see complaints coming down. In fact, coming down quite dramatically. A little bit about the number of calls that the service receives. Every week it receives on average around 500 calls from clients. It's not talking about calls from groups or from the department or anybody else, about 500 calls a week from clients. And it can go up and down, and it can be much higher than that. In addition to that, there is on average between 50 and 60 drop-in callers. Sometimes these are people that are known to the service, sometimes they're not known to the service. Often they can come in a state of high distress and high anxiety, and staff have to be able to come out and deal with that. And also every week we get something like 60 new requests for an appointment to go through the needs review process. So what I want to get across to you is that the service is dealing with a very large number of people, and those people are, in many cases, distressed, anxious, emotional, traumatized, and looking for support. And it isn't a case that they can be dealt with in a few minutes. They need to be dealt with in a very serious way, and it takes time. So that's a lot of work. And that's why we put in that training that I've told you about. I've mentioned mental health, and I've mentioned the importance of ensuring that there is a smooth transition from the service. We don't ever want to be in the position where, as a service, we're saying, there's where your mental health support is. In the NHS, off you go. That's not the way we want it to be. We want it to be where we are working with the person, with them, alongside them, and helping them through the process so they get the support that they need. One of the terms that we use in the board is person-centred culture. That's what we want to create within the service. That's being incorporated into training and also supervision. One of the points in the review was there needs to be stronger supervision. That has been implemented. Everybody receives a monthly supervision meeting on top of the day and daily, week in, week out supervision. But supervision in an organisation like the VSS is in part what I would think of as traditional supervision, which is ensuring that people are doing what they've been asked to do, tasked to do. But it's also about ensuring they have the support, because sometimes people can meet with an individual outside who is highly traumatized, and they come back from that and they themselves are quite distressed and need support. So it's a combination of those. But I want to assure you that that has been implemented. Not only has it been implemented, but as a board we ask for and receive a report on how that is going every month. It's important to state that our Chief Executive has been through a period of rapid change. The organisation is changing dramatically as a result of the reviews, but these are changes that we as a board would have wanted to see anyway. And one of the things that she has done is to enrol with a high-level course with the Tavistock Institute in London, where she is working on the subject of how to manage organisations that work with vulnerable, distressed, traumatised people. And she's meeting with people who are at the leading edge of that in the country and bringing that experience and know-how into the service. And I think that's a very important thing. And I have also implemented the appraisal system, and the CEO and I are going through that at the moment. So she has a new set of objectives that relate to the type of organisation that we want to create, and she will be held accountable for that by myself, Chair. To return to the reviews, I just want to say that we were happy that the accounts and annual report were published with the controller and auditor certificate. That is to say, they were unqualified. And all of the issues that were raised in the internal NICS audit have been satisfactorily addressed. We have gone a step further, as we have appointed our own internal audit function, because we want to be ahead of the game. We want to be able to see those things that are starting to or might even begin to give rise to concern when they're little tiny things that we can deal with them and make sure effective action is taken. We've also appointed our own Audit and Risk Committee, and we have set in place the scope of the audit. I think that's really, I'll probably be talking for too long, but I think that's as much as I should be saying.
Okay,
I'll hand over to you.
Appreciate it, and once again, I thank all three of you for making yourself available. Let me begin just with a point of clarification, if I may. The switch from the INR, the individual needs review, to the GNR, the general needs review.
Yes.
You said on the GNR, how many people?
I said that
2,000?
something like 2,000 people have come through the GNR.
Right. In the papers you submitted to us, and this, members, is page 108 of your pack, at point 4, the GNR has been successful in it as it enabled 1,300 to come forward.
Yeah, but there's been more since that original paper was written.
And when was
a
the
large
paper
number
written?
of people. That paper was written a couple of weeks back for you. But the latest information is we now have 2,000.
Well, that would suggest you're on a rapidly rising graph.
It has
You're
been
saying
a large number
700
of people.
people in the last 2 weeks?
Sorry, Chair, 1,300 through groups, because groups were able to do the GNR process, and 700 directly by the service staff themselves. So 2,000 in total.
Okay, thank you. The 70 recommendations.
Yep.
Now, you're saying 29 have been implemented?
Yep.
23 partially implemented? Would it be fair to say, and again, I'm just trying to be accurate about the categories here, the implemented 29 that have been implemented are all internal to the governance of the VSS?
In the main, yes. Yes.
So there's been nothing, for example, in interaction with groups and individuals? Nothing fully implemented?
Well, I think we're well on our way to implementing those.
So that's it.
But
So you're saying they haven't, you're agreeing with me they haven't been fully implemented?
I'm agreeing they haven't been fully implemented, and particularly those that relate to individuals have not, because they depend upon the finalisation of the health and wellbeing review process, which will be the way people come into the service.
Okay. And in terms of the funding review requirement, nothing fully implemented as yet, just for accuracy.
Sorry, can you say that again, please?
In terms of the funding requirement review, nothing fully implemented.
I think that refers to, as you know, we're in a 2-year programme. So when the service moves to a new programme from 2015 onwards, that's the time that we would look at any of those fundamental issues regarding funding.
Okay. In terms of monitoring and evaluation, nothing fully implemented.
That is in consultation at the moment.
Okay. In terms of assessment process,
That is in consultation at the moment and with the Commissioner.
right, and communications and engagement,
Communications engagement, we have our strategy, we are implementing it.
but nothing fully implemented as yet.
The website was
The website is in the process. It has been reviewed and has been improved substantially.
Right. I think what I'm coming to here is perhaps a concern about timelines and when. And I accept in terms of governance, there's a lot to be done, and you know, you have to get your ship aligned to be able to sail in the right direction. But how are we on timelines? When do you think you would be saying the 70 recommendations have been implemented in full?
I think we will implement them all in the timescale in which they were set out, because a number of them are not due to be implemented by until the end of May, some end of June, some July. So I'm confident they're going to be implemented within the timescale that was given, agreed with the department.
Okay. What I don't see here, Peter, and I do see a lot of columns, obviously, the summary action, the owner, the action that's required, timescale, measurement, how you measure the thing in the progress update. What about risk? Have you done any risk assessment?
Well, we do that within the board. We have a very sophisticated risk assessment procedure that we operate. Yes, we do have that.
And is that applied to these 70 actions?
It reads across all issues to do with governance and operation of the service. Do you want to?
I mean, the chair is absolutely right in how that the executive team report to the board on a monthly basis. I mean, there is a plan. I'm not sure what you're looking at, but there is an implementation plan for those recommendations. And as the chair says, 29 of them have been fully implemented and some have been partially implemented. And really that is just about providing the documentation around those implementations. The executive team go through each and every one of the recommendations every month and attach a risk to that, a corporate risk register and an operational risk register, all of which are reflected in our own implementation plan by the executive team. Very happy to share that with you if you would like to see that.
Yeah, personally, I would. So if we take just the first of the 70 on the implementation plan, summary action is collaborative relationships should be developed further between key VSS stakeholders, including the Victims Forum. So do you have a risk matrix that says likelihood of it happening and then
Yes.
impact if it doesn't?
Yes, we do.
All right, okay.
And as the chair's already explained, a lot of that is already in place in terms of the board meeting with the forum and so on a regular
Okay.
basis.
Appreciate that. Peter, you talked about going out and meeting stakeholders.
Yes.
Which of course is absolutely right. I mean, obviously as a former commissioner, I remember doing that process 6-7 years ago, and forming a very definite view in terms of how I and the other three, as it was then, how we were greeted, particularly by groups. How are you being greeted?
I've been greeted very, very well. People have been pleased to see me and my colleagues. I'll ask Oliver to come in on that. I spent about 4 hours at one of the largest groups that we have. We had a very cordial time. I won't pretend there weren't issues of disagreement, but that's inevitable. There are going to be. But I would say that we're getting a message out there, which is we want to come and talk to you and we want to listen to you. We won't always agree with each other about everything that we say. And perhaps to some degree we're in a honeymoon period at the moment. I would say that. But I'm certainly enjoying it. Do you want to come in on that, Oliver?
Yes, Chair. I think what I have noticed is that, and some, as I'm sure you have found from your experience, some of these groups are very direct. They just tell it to you as it is. And there was a sense, and there is a sense that they perhaps couldn't speak openly in the past because there was a feeling that maybe that might have meant that they wouldn't have got the money that they needed to run their services. With us, and certainly we've encouraged them to be as open and as direct with us. And if they want to criticise, let's hear it. And be confident that you're talking to people who will not allow your funding to be reduced in any way if you say something that we don't like. We are trying to get across the message that we want complaints, if there are complaints. We want to hear what will make this service better. We're up for it. And people are giving it directly to us without fear or favour. And it's really good to go out there, as I'm sure you have found.
Oh yes, I think they are admirably direct. I mean, in my experience, there was no personal animosity, but there was a kind of a scepticism and a cynicism in terms of you're far from the first group to come and say we're here to help you, and I'm sure you won't be the last, and indeed we weren't.
That's right. That's right.
Okay, Alex Maskey.
Thank you, Chair. Thank you, Chair, and your colleagues for your presentation. And it's good to hear, some of the, firstly, all of what you've said so far in terms of dealing with the recommendations and working with all of that. For me, it kind of largely focuses on governance issues and management issues and getting the systems in place and that's all very, very important, and glad to hear that. At what point, would we be able to tease out then more of the substance of the programmes and what way the programme might evolve? Because obviously when you're discussing with groups, yes, clearly there's been a lot of complaints and criticism around the management processes, but ultimately the process is only there to provide services which are appropriate. So I'm sort of keen to get the governance and the management, all that right, and get it in place and continue to tweak that as needs be. But at some stage then we need to have some discussion around, for example, when you're talking to groups, at what point would you be then saying, you will continue to support groups? What's the criteria for not meeting group, but
Yeah.
Perhaps supporting groups. I mean, are there 2 groups in the one street in some places, and none in any street in other places? So how do we kind of then get to grips with that? That's the first thing. Sort of what stage we like to begin at that, because I mean, I'm still hearing people questioning issues around like breaks and respite breaks. What does that really mean? How many people got them, many haven't got them, who's eligible, so on. So it's really then the substance of what you're there to do and provide.
Yeah.
Once you get the system in place that allow you to do it efficiently.
Yeah. Well, thank you for the question. On the question of governance and management, I think you've heard that we're really on that as a board. We're also very aware of the issues that you've raised. Because we're hearing that from people, and I am aware that the Commissioner is going to look carefully over the next 6 months, well, the Commission will be, looking at what are the kind of services that should be provided. So I think she's got that firmly in her sight. It's something that she is looking at, and we as a board have said to her, we want to work with you on that, because we are hearing an awful lot from the people that we serve. We want to put back into that. Also, as I say, we go to the forum, and at the last forum, the members were saying, actually some of the things that you've just been saying, you know, given the fact there are more and more people who are coming into the service because it's now easier to get in, because you're more accessible than you used to be. There's the question of, you know, can you continue doing everything? And the forum itself has come up with ideas and saying things like respite breaks. Well, we think that respite breaks should only be for example, carers or seriously injured or bereaved. Now, it's not our role to say yes or no to that. It's our role to listen to that and feed that into the work of the Commission, who will be the body that will be giving advice to ministers, saying, well, actually, you know, you would be better using your money in this particular way. So our job, I think, is to listen and pass that on, be close to the victims, close to the forum, close to the groups. The other question that you raised was about the groups. And yes, there are a lot of groups, and I know that there are places where there are a lot of groups in the same vicinity. I think that, you know, at the moment, our view as a board is, you know, we're not here to change that. We're here to know and understand how it's working. And I'm still at the stage of getting to understand. For example, I mentioned I'm going to spend a day in Oma and I'm going to see 6 groups there. And I know that, you know, there are 6 groups in Oma, but I don't at the moment have a handle on what they all do. But in a way, it's not for us in the service to say there should or shouldn't be, because we're implementing a programme that ministers have said we want you to implement. But obviously we'll have a view in terms of what we hear, and we'll feed that back into the Commission and the Commissioner, and it will be for them to say, well, actually we think you should be doing this with groups, or we should be doing this with services.
And just the final point on that, Chair, thank you, Peter, for that. And in terms of, I mean, because you did refer earlier on to a communication strategy, so at what point will people have an understanding of where that circular process starts and finishes, if you get my drift? People
yes.
are making the arguments.
Yes.
People saying there's what should be maybe done. You're having direct experience, you're having direct engagement, you're delivering on the mandate you've been given. But at what point, if that needs to be changed, would people have an understanding that their input is meaningful?
Well, when we meet with people, we tell them what our role is, because sometimes people don't understand what our role is. They think we set policy sometimes, and we don't. We implement it. So we always explain that, but we also say, but we want to hear your experience, and we will then pass that on. And I will say to people, this is something that is going on with the Commission at the moment, and I would expect that it will be well into the autumn before the Commission is coming up with proposals, and then they'll consult widely on them. You know, so then they'll be coming back to the forum and to the sector as a whole. So that's the message that I give, Alex, when people ask me.
Okay, thank you. Thank you.
Peter, can I just develop this a wee bit, because I think it is a key issue, and we'll not focus on OMA, but you know, reference has been made to the fact, yes, that there's a multiplicity of groups. But let us say, in a defined geographic area, an event occurs and 100 people are injured. It is it's just the way of it that maybe 20 of them want truth and justice, but maybe another 20 of that 100 just want to move on and forget about it. So therefore, you know, if you start off with a group of 100, you immediately have two groups.
Yes.
And then you have maybe a third group who are saying, the 20 of us, it's our physical pain relief that is the issue. And then there's others saying, well, actually, it's mental health and well-being. And maybe the fifth are saying, no, it's my children and my grandchildren and their education.
Yes.
So
Is that bad? Is that bad?
exactly,
No?
exactly. But that really is policy. So it's beyond, it's the department really rather than the Victims and Survivors Service. Or what is your input into that?
Okay, I think I'll ask you how the groups come into work with the service. You can explain that.
The way that works is that, I mean, the groups would apply into the victim support programme, and they have to provide an evidence of need, a needs analysis, which goes in an independent panel for selection. So all of that is marked in terms of the application itself. I think just to refer back to some of the geographic location of groups, I mean, we in the service would be satisfied that there's no duplication of services in those areas. It's not that, you know, clients are moving from one group to another and getting the same thing in different groups. I think you're absolutely right, Chair, that people go to different groups for different things, and we're satisfied that those services are provided. They do provide monitoring and evaluation reports quarterly, which are signed off, and we're very comfortable around that. Certainly the board have asked the executive team then to provide them with geographical spread and services, and we're in the middle of doing that to inform the Commission and policy makers moving forward about how that may want to be done. So very much, we're very mindful of it, but very satisfied that there's no duplication of services around that. And again, it is about client choice and where victims feel comfortable in the access point to get to services.
Okay, and the converse of there's no duplication, Anne, would be, are there any black spots where you are not geographically providing funding?
Yes, that would be correct. Certainly that there would be some that we have identified in the past. We're very pleased to see some new groups enter into those areas in the last 18 months. But there certainly would be, as you refer, areas that maybe could have better coverage than they do.
And how do you address that? If you're awarding money on applications which are judged against strict criteria, if the group in that geographic area doesn't meet your minimum standard, they don't get, and therefore there is a black spot geographically.
I think that's correct, and it's something that we'll be looking for and informing the Commission and the Department about moving forward. All the letters of offer have issued to groups now, except the small grant scheme. So it's something for us to learn moving forward into 2015 and inform the Commission and the Department about how that may be addressed.
And who would build the capacity of the groups so that they would come back with a robust application for you? Is that?
That would be the service. That would be our project officers would look at that, and indeed they do. And the fact that we have an independent selection panel has freed our guys up to be able to do that and provide the support to new groups and groups that are thinking of things in certain areas. We're very keen to support people to do that and provide whatever information that we can. And a number of new groups have come forward in the last 18 months.
Excellent. Okay, thank you.
Chair, could I just add, I think there's just an issue of timing here. At the stage that we're at, we want to get out a message that we respect the work of organisations out there that have been working for many, many years, supporting people with very little resource and doing a marvellous job. We need to establish the right kind of partnership with them so that we support them in what they're doing and how they can do it better, and then extending that if need be in the way that Anne has said, to include areas where they're not quite able to reach at the moment. So it's a year from now, there would be a question for us on that matter. But right now, we need to value and support and build good partnerships.
I understand if you're giving public money to a group that they must be held accountable for how they use it. But if we think about the origins of these groups, it tends to be people whose loved ones were hurt. And they didn't get involved because they had a competence in human resource or accountancy. They did it because they had felt a moral obligation and common humanity.
Yes.
And that's I suppose that's the balance. Ronald again.
Okay, thank you for your presentation, and the question I was going to ask has been sort of covered, and it's regarding how you decide on which groups. And I'm referring back to the OMA example where you have several groups on the one street, maybe potentially offering similar services. And how do you measure the outcomes of those groups in terms of the delivery of services? And I know the Chair made reference to maybe potential gaps in other areas. So.
Do you want to say something about how you specifically measure the impact of the...
Absolutely. In terms of the letters of offer that groups receive, there are criteria that they have to meet, and that would have been detailed in their application. So it could be things around, if it's mental health and wellbeing, it's how someone has exited from that particular course of treatment. If it's social support, how did they find that event? Has their quality of life improved as a result of that? So all of that information is captured. As Peter has said, that monitoring evaluation tool is under review at the moment. The Commission has agreed that process, and it's with Programme Board. And what we're going to do over the next few weeks is go out to consultation with stakeholders to get their views around that and how that information is captured. We do quarterly monitoring returns with groups, and we capture the information, say, has the individual's life improved? Where it's mental health and wellbeing, the outcomes are actually very well monitored by the groups. They're very, very responsible in terms of how they do that. Well-qualified tools, things like CORE, Salesforce. There's a number of tools that groups use that we can monitor. So all of that is fed back into the system. And I think going back to the question around, the numbers of groups in OMA, we're satisfied that their individuals aren't having a duplication of services, that each of those groups is very valued in that area by their clients and members themselves. We don't have an issue around that, and it is around where people feel comfortable going. There's a number of groups in Belfast as well, so it's about trying to make it as easy an access point for individuals to get the services through groups, and more recently to be able to avail of those the GNRs, which has been a tremendous success for those individuals to get access to the services that we provide.
On the subject of monitoring and evaluation, measuring the impact, I'd have to say the groups in the main understand clearly that does need to be done, but they want to be part of the decision about how it's done, and we want them to be part of the decision about how it's done. We want to have a monitoring and evaluation system that they don't perceive as something that's done to them. They don't perceive it as something that's overly bureaucratic, but they perceive it as useful in terms of helping them understand the impact they're making and to be accountable for the money that they get. And I think there's a openness between us on that.
And Chair, as we have begun to ask groups, how should we be monitored and evaluated? It's very interesting. They're not saying that it's a numbers game, how many people come through the door.
No.
But they have really good information on how Mary has progressed over the past year, from a point where she wasn't able to go out, she wasn't able to socialise, she wasn't able to pick up an educational opportunity, and so on, and now is able to do that. And they have this information, so the better way is for us to get that from them and inform ourselves and inform you as to how public money is used, rather than imposing something on them.
Okay. Deputy Chair, Chris Little.
Thanks, Chair. Thanks for your presentation so far. I've had a number of questions about governance and staffing. I'm going to ask you a couple of questions in relation to operations. The VSS website currently states that applications for financial assistance Scheme 6 have not yet opened for April 14 to March 15, and that a review of the scheme and the policy that has been governing it for the last number of years is currently underway. A move to a more streamlined approach in the administration of the scheme will be developed as part of this review. Can you give us an update on the current status of the review and when the scheme is likely to reopen?
I can. The decision has now been made. First of all, the Scheme 6, which is the one that provides a payment. It will be a one-off payment that people will receive this year. It won't be a quarterly payment. It'll be a one-off payment. That scheme's already been opened to those who are seriously injured. So those are in process at the moment, and people with serious injury will be getting their money very soon. If they haven't already done so, they'll be getting it soon. That then takes us to the others, and a decision was taken just last week, in fact last Thursday, that the scheme would be opened under these principles, that it should be made as fair and open for everybody as possible. Now, there were a lot of problems the way the scheme was implemented last year. I wasn't here at that time, but we know it was heavily oversubscribed. There was a closing date, and many people applied after that time, and it was not considered to be a good experience. Now, in order to avoid that this time, the decision has been that everybody who wishes to apply and is eligible to apply will have a time period in which they can make that application. And I will ask Anne to tell you the exact timeline in a moment. But the way it's going to work is that there will be a global amount of money available for Scheme 6 applicants other than the seriously injured, and that we won't know what the individual amount that each person will receive will be until we know the number of eligible applications that are received, and the one will be divided into the other, and that will determine what grant will be paid. Now, that's a decision that's been made by ministers, and we were informed of it last Thursday, and we are now in the process of implementing that. Can you speak about the timelines?
Apologies, that's not up on the website. It will be in the next couple of days. We're just finalising our documentation around that. So the budget for Scheme 6 is £1.8 million. Around 300 people who are on the higher rate DLA care component are not means tested and are known to the service. They've already been written to ask them to complete a self-declaration form that their circumstances haven't changed. On receipt of that, we'll be issuing them with a cheque of £1,000. The remainder, approximately 1.5 million, will then be distributed across the number of people who have successfully means tested and are eligible at the end of a 4-week period. We're looking to open that 4-week period on the 2nd of June. At that point, we'll be then advertising for those who are new applicants, and will be getting an application form to complete, and they will have to complete bank statements and so on as they did last year, but that's only for new applications. Anybody known to the service will receive a self-declaration form where they'll be asked to say whether their income and outgoings have changed in the last year and sign that off. So that make it a much more streamlined process for anybody already known to the service. As Peter said, at the end of the 4-week opening period...
As quick supplementary, known to the service, does that include people that would have applied previously out with the deadline and were unsuccessful?
No, that's not, but we'll be doing roadshows later on this month. We'll be doing information sessions, and we'll be advertising to make it as open and fair and accessible as we possibly can. So anybody that received Scheme 6 last year will receive a letter from us and a self-declaration form, and anybody then else will contact us to get an application form. So at the end of the 4-week period, we'll know the number of eligible applications having gone through the means test, and as Peter said, the 1.5 million thereabouts will be divided by the number of applications, and then the amount will be awarded in a one-off cheque. So we're looking at payments in around July.
Yeah, at
Do
best.
you think that 4 weeks is long enough? I asked that question from the point of view that the deadline approach last time around proved significant difficulty to many people. So do you think that creating a 4-week window is going to address that difficulty?
Well, what we want to do is to announce it very quickly so that there will be a period between now and when the window opens for people to get themselves prepared. So it isn't the case that we're going to announce it, you've got 4 weeks from now. So we're going to be publicising it really from this week onwards, so that people are aware of it and they'll know that it opens on 2nd of June and there will be 4 weeks. And I also want to say that if people want to come into the service and they want to bring their paperwork and ask to see, have I got everything right, have I got everything that's needed, the service will be there to help them with that.
Okay, so it's about using a limited amount of money.
Yes.
And it's clear the department still doesn't have a clear idea on the full scale of the demand for this type of assistance.
I think it's more a case of the budget is limited. I think they're saying to us, that is the budget, that's what you have, and we want it to be made available to as many people as possible, and who are eligible, and we want the process to be open and fair, and that's why we've got this period between now, which is still relatively early May, and the 2nd of June, when we'll be out notifying people of it, so that people have time to think about it, and also why during the 4 weeks we will be open in both offices to allow people to come in and talk to our people to make sure that they're satisfied and we're satisfied they've completed the paperwork properly, because what we don't want is people not getting their money because they don't complete the form correctly or they miss something that they would need to have. We don't want that to happen. We don't want people to be disappointed in that way.
Okay, I have no reservations about limiting it to 4 week period, but that's where we're at this moment in time. It would be good to know in a bit more detail the communications plan around that to help address some of those concerns. The department has also advised that the Victims and Survivors Service has been asked to produce a paper for Victims and Survivors Programme Board regarding the impact of the cessation of Peace 3 funding for victims and survivors groups. Has that paper been produced, and what are its findings or recommendations?
The paper has been produced and it was tabled today at the programme board.
That's
Do
correct.
you want to take us through
Just to pick up in terms of Peace 3 and Peace 4 is, as you were, not known yet. I mean, one of the things that concerned the service a couple of months ago was the fact that should any of these groups fold because they've no longer got Peace 3 funding, that victims would remain unsupported in that period until a new VSP. And as I said earlier on, all our money has been awarded at this stage. We've nothing further to add. So potentially 6 groups could have lost or not lost out. Their funding ended, and as I say, victims and survivors remain unsupported. So the service is very keen to understand the volume and capacity that's out there in order to pick up anything that should happen. We've prepared a paper for programme board. Ultimately then, if programme board support that, what the service would need to do is actually then submit a bid in the June monitoring round in order to avail of some funding. And again, we don't really know that until we put that paper in, and indeed if programme board support it. But we're very keen to ensure that there are no victims and survivors who are left unsupported in any gap in funding moving forward, as best we possibly can.
I mean, are the groups that be close to folding in June? Is this not something that should have taken place in the February monitoring round?
I think moving back at the time when the Victim Support Programme opened in November 2012, groups applied at that point. Now, in theory, it's up to a group to ensure that they have funding and apply for funding that's going to take them right through to 2015. It only became apparent around November, December time that this money was going to run out, but ultimately the funding issue is a matter for the group. And our concern would be that people would be left unsupported moving forward.
Okay. This last question, Chair, one of the main requests from the recommendations was to ask the Chair of the Board to provide an assurance that they're confident that the knowledge, skills and experience of the senior management team and the Board are appropriate to deliver the changes necessary to meet the outcomes required for improvement. Can you give that assurance today?
Yes, I can. The board met in camera. We had a full and frank discussion about it. And we are, all 4 of us, of the view that the senior management team have the skills, have the knowledge and the experience to implement changes that are required. We know that they've been through a difficult time. But we think that now in the new situation, with an independent board there to support them, and also to support them through the management processes that will be implemented, like appraisal and like regular monthly meetings between the chair and the chief executive, that we believe that given those normal management tools being implemented well, that yes, that the skills and the experience, the knowledge and the structure is fit for purpose. That's our view.
Thank you. Thanks, Chair.
Thank you. George Robbins.
Thank you, Chair. Yeah, thanks to the team. My question's around accessibility. And Peter, you had mentioned there a bit earlier about 2 offices.
Yes.
Are those both based in Belfast?
No, we have an office in Dungannon. That office is not one that is normally open to the public, as in they can drop in. They can come in by appointment, is that right, Anne? But it's not normally open. But the office there is in Dungannon to serve people.
That's what my concern was, that how do you get the message out to the general public and groups and so forth, just where you're based? Would it not be better maybe having satellite offices throughout? I mean, Northern Ireland's fairly,
Good question.
area to service from their point of view, and there's quite a lot of groups out there.
Very good question.
Just knowing that you're there and how they get in touch with you. I know there's telephones and so forth and emails and all that sort of thing, but there's lots of people, I'm sure, prefer to speak to you face to face, or
yes,
it is.
I think you've put your finger on something that the board is looking at. We're thinking very hard at the moment about where we should have our premises, and that's one of the things that we're definitely going to be looking at over the next few months, is where we should be. And everything is up in the mix. There are arguments for why we should stay where we are. There are arguments why we should move. But there are also very good arguments for saying we should be more accessible in other parts of the country.
That's right.
And so we need to look at all of that and look at what's realistic and what's affordable. And that will take us some time to work our way through that. But it is on our agenda to do, I can promise you that.
I appreciate the financial aspect of the whole aspect of what you're trying to do. Quite a lot involved there, but still, from the group's point of view, the more accessible you are,
the better.
The better. Thank you very much.
Just on that, Peter and Anne, have you any research in terms of what percentage of victims who come to you don't mind being seen, being known, being victims, engaging with the service, and those who would prefer to be able to do it anonymously?
Well, I'll hand over to Anne in a second. What I do think is that the benefit of a city centre office where people can just walk in off the street is there is a degree of anonymity about that, which is an advantage. And as I say, we do get between 50 and 60 people coming in on a regular basis.
I think, Peter, I don't think we have any actual statistics in terms of how people prefer to approach. What I can tell you is that a number of people would say, perhaps if they live in Derry, they want to come to Belfast to be seen, they don't want to be seen locally, or they want to go off site or be seen maybe in we would have done assessments in libraries and health centres. Anonymity is important to victims and survivors, and we would respect that. And as Peter says, bizarrely, while Great Victoria Street is extremely busy, it does present a huge degree of anonymity. It's very accessible in terms of trains and buses and things like that. But it's certainly something I look into. My colleagues may know better than me in terms of how we might be able to capture that.
I just think it's an interesting question. One of the reasons that the 4 commissioners chose Windsor House was not only city centre and public transport, but you walk into Windsor House, you'd be going to one of over a dozen public bodies.
Exactly.
Jump in the lift, nobody really knows.
Certainly, Chair, one of the things that we will be aiming to do within this year is to draw up criteria based on which we will determine where's the best place to be, or where are the best places to be. And there's a lot to be said for city centre, a lot of people, so you're anonymous in the crowd, and 50 to 60 people, some of them very ill people, are walking in off the street every day to an office which many, I think, would perceive as simply that of processing paper, but is dealing with some very damaged, very difficult individuals, and doing so very well. I don't want to lose that, but I do take your colleague George's point about being how can we make that accessibility even greater?
Right, but particularly in the northwest.
We're thinking about that.
Could I also just add, Chair, in terms of, I think that was one of the successes, if you will, around the GNR process, is that as we're talking about anonymity, 2,000 or 1,300 victims and survivors felt more comfortable going to a group's premises and undertaking that conversation there. So I think not to be lost, I think it's going back to the earlier point like Oma, it's about providing access points where victim and survivor feels most comfortable and safe and secure in accessing those services. So it's about finding that balance as well. But 1,300 were conducted through groups on groups premises, and I think that has to be commended.
Okay, thank you. Leslie Cree.
Thanks, Chair. I was interested to hear your answers about the numbers game. Always gets back to that again. How fit for purpose do you consider your budget to be?
Well, let's put it this way. I don't think the budget's going to change over the next year. I think that given the increased numbers of people that are coming forward, it's clearly going to put pressure on the service. And I think that decisions will have to be made as to where the priorities are. And it's interesting that it was the Victims Forum working group that came to us and said, well, actually, you know, we're aware of this and we think these are areas that you should be looking at. And they identified a number of areas where they felt that there should be priorities and some that would be lower priorities. Now, that's very helpful, and we're very pleased that that working relationship we have with them and the Commission is allowing that kind of discussion to happen. And that ultimately has to go to the programme board, who will make those decisions. But if you ask me, will the service be able to carry on operating in exactly the same way with a large number of new victims who are eligible and meet the requirements of the order? It's clear it can't. So there has to be some reprioritisation, and that's something that has to be done in consultation with the Victims Forum and the Commissioner, and then through the programme.
Well, would you see yourself sort of preparing, if you like, a draft budget, bearing in mind the consultation?
Yes, oh yes.
When would you hope to see that?
We're in discussions with the department at the moment around our draft budget. We haven't actually received our draft budget for 14-15 yet, so it's on receipt of that, which should be in the next couple of days. I think we'll be able to have a proper assessment and we'll make recommendations to the board.
I'm actually thinking of the next year, because June monitoring's round the corner. The draft budget for next year will be probably September. You know, so you really need to get in early before these things sort of firm up. And it seems to me a much better way to do it if you can in some way, I know it's not easy, quantify the actual monies that you may need, rather than simply waiting on a handout or a hand down and then simply saying divided by X. You know, it's not really the ideal system.
No, it's not.
Certainly ignores need, doesn't it?
And I think that's what we want to do, and we want to have those kind of discussions. And I do think that reprioritising within the overall budget is likely to be necessary, but it has to come through that process of consultation, and it's good that it started now.
It is, very much so. Yeah, thank you.
Okay, Bronwyn, did you want?
Yeah, just another question. Do you feel that the board has the capacity to implement the outstanding recommendations? And I think the review did make a recommendation about increasing the board's membership.
It did, and that's a matter for the OFMDFM to do. And I understand that that's with them and they're working on that. Okay. But we're a board of 4 people, and it was a recommendation from SITFA that we should be 8. I think I'm right in saying that. But that's a recommendation that sits with the office.
Okay, thank you.
Well, how do you feel, Peter, chairing this body, you know, given that the lack of a fully constituted board was the primary criticism of WKM's report, and now you and Oliver have stepped into a public service role at a extremely high tariff, I would suggest. 4 of you when there should be 8. I mean, are you exposed? And what impact also does it have on the hours that you're having to put in?
Well, it's certainly having an impact on the hours that we're putting in, that's for sure, because we're all putting in far more hours than we're budgeted to do. But I think there are also some important skill sets that we would like to have on the board that we don't have. For example, it would be good to have a board member who has got good understanding of a public body that is dealing with members of the public in large numbers. because that's what we do. It would be good to have somebody who's got that skill. It would also be good to have somebody who's got public sector finance and accounting experience on the board, to mention two, that are there. So yes, there are other skills that we think would be helpful to have on the board for sure. But my understanding is that that's something that the OFMDFM people are working on.
And just before I bring Stephen Mitry in, on the board, there was a recommendation that all appointments were consistent with the Commissioner for Public Appointments.
Yep.
You have this down as implemented, but a commentary that says there were specific problems in this case. Can you?
Sorry, Chair. It is not for us to implement that. That is something that the OFMDFM have to implement. It's a recommendation that lies with them and not with us.
So, can you tell us what those specific problems were, or not? No?
No, I don't know.
Right, that's fine. Stephen Mitry.
Thank you, Chair. Just for some clarity in relation to the office at Dungannon, can you expand on what the status of the office is? Peter, you said that people could go to either office to have their forms checked or whatever, and then I think, Anne, you said that it's not open. You have to make an appointment.
Yes.
On your website, there isn't a phone number for the Dungannon office.
There isn't.
So, and I think there has been in the past, and you're aware of this, and maybe some confusion around it. Can you just clarify it, just so that everyone's clear in relation to it? And perhaps you could give us an indication how many staff are employed at the Dungannon office out of your total?
Right, I think you better give that information.
Just to be clear, I mean, the Dungannon office isn't an open office, not a public office, that you go there by appointment. And that's why there's only one number in terms of the Belfast office. Okay, so we can patch through in that one. For the purposes of Scheme 6 opening, it will be manned, 9 to 5 in order to facilitate anybody wanting to bring their forms in and be checked. And all of that will be very widely publicised at that point in time. There are 3 staff that have been recruited and are in post in the Dungannon office, and they were tupied over from CRC at that point in time.
Okay, and it's expected that office is going to remain then, long term?
That's something that we've got to look at. As I said, we have to think about where we should be in terms of giving the best service, and we haven't really made very much progress on that, to be honest.
Sir, just make the point, despite what we say in relation to the anonymity of a city centre office in Belfast, if you're coming from West Fermanagh, it's a day out.
Yes, we understand that. Well, we understand that, and that's why I think we've given you the indication of what our thinking is, that we think we need to make ourselves as accessible as possible, and we need to look at how we actually use what resource we have in terms of where we put our office and our people, and that's a job we've got to get ourselves into this year.
Okay, thanks. Lecture.
Okay, do you want?
Yeah, could I just ask you, do the 4 board members share the salary of the 8 then?
No, they do not.
What a mercenary question.
This follows the logic of the distribution of funds that we're talking about.
Scheme 6.
Okay, just 3 or 4 points we'll finish off in terms of these 2 reviews. The SIPFA, I think, recommended that the programme board should be put into abeyance effectively to let you get on with your roles. Where are we with that? Have you a view on when's appropriate?
Well, I was discussing that with a senior person in the office this morning, and he told me that he had proposals on the programme board agenda for this afternoon about a change in the way in which they handle their business. So I think it is likely that the programme board will not continue in its present form. But there was a paper tabled today with some outline proposals, and we see what happens as a result of that.
Again, SIPFA's report said the DFP, Department of Finance and Personnel, undertook an internal audit.
Yes.
And the findings were reported in November last year. SIPFA then said the DFP report included a schedule of recommendations that were largely accepted by VSS management. Can you tell us which ones were not accepted?
I think they were all accepted.
I think they were all accepted.
They were all accepted.
And just to be clear, Chair, a follow-up review has been done, and we're just waiting clearance from the department on that.
Okay. But that is a quote from the SIPFA report. largely accepted?
Yes, yes, no, we accepted them all.
Okay. Then to the WKM report, which said, incredibly, and this is their language, incredibly, all assessors told us they had had no formal training in using the independent needs review. The VSS have since countered that training was given. There's clearly a lack of shared understanding of what constitutes training. Is there anything you can say to enlighten us on?
Well, I can only talk about what I know from this year. And what I can say is that a lot of training has been given to staff who are carrying out these reviews, and will continue to be given, because the board will insist that that happens, and the board will ask to see the results of it, and will be seeking assurance from the executive that everybody who's carrying out these reviews has been trained and has achieved certain levels of competence. So we will insist upon that. I'm going to have to ask Anne to tell you what happened before we took up our post, because I don't know.
Just to be clear, Chair, I mean, that recommendation or finding was raised, and we were able to provide evidence that assessors had indeed provided those training. They'd signed them off at that time. I'm not quite sure why it didn't follow through into the report, but I mean, that evidence is there.
Okay, well, if members are content, I would like to thank Anne and Oliver and Peter, and to wish you well for the future. I think when the committee took a look a few months ago, we maybe didn't think we would be returning to the subject just quite as frequently as we have, but I hope you take it as a sign of our committed interest to getting it right. And I don't think anybody at any point has felt that anybody has been out to do damage. I think certainly there have been a feeling that sometimes things could be done better, and it's appropriate for the committee so to do, and I'm sure some people feel quite bruised, and unfortunately that is part of the nature of public service.
Absolutely.
But once again, Anne and Oliver and Peter, thank you very much.
Thank you very much. Thank you.
Yeah. Members, just on foot of that, if you go to page 87 of the packs, recommendation 53 in terms of the implementation is the one I was talking about, where all board members should be appointed using the process recommended by the Commissioner for Public Appointments for Northern Ireland. And then over to the right, you see already implemented, but there were specific problems in this case. And Anne said, you know, that was for the department rather than VSS. Are we all content then that we write to the department and ask just for clarification on what the issue is? Okay. Thank you very much. So, members, to agenda item 7, it's to consider a written briefing from the department on the summary of responses to its consultation on the good relations indicators. Page 218 of your packs refers, and also in table papers, page 19 is a briefing highlighting some of the main issues that have come out of the consultation. Chris.
It's just a written briefing?
Yeah.
Okay. They didn't want to come and speak to us?
You may conclude that.
Can we request they come and speak to us?
We can, if the members feel that's...
We can discuss the briefing.
Sure.
We didn't specifically ask for no briefing on it because it wasn't one of our priorities.
Of enough briefings?
Yeah.
That's why we didn't ask for the oral briefing.
It wasn't a priority, in fairness, Chris, but
Okay.
if... So I'm not sure that there's anything in this that is surprising, that is beyond what we expected in terms of the criticisms, the perceived shortcomings.
Just be useful to hear how they intend to respond to them. You've obviously got need for clear definitions how they're going to quantify certain aspects, need to extend indicators beyond to community approach, concern about a reliance on just Northern Ireland Life and Times data, and concerns regards removal of an indicator with regards to integrated education. I just recall the department's initial briefing in relation to it being quite minimal. It'd be interesting to hear how they intend to respond to the points that have been raised.
Well, we'll have the clerk's note at page 19 on table papers. Are we content to agree that that is a summary that we support as a committee? Because we could then maybe
Draft the submission.
yeah, if the clerk's content, we could pass that on to the department as a summary of our response to the consultation results.
Yeah, that would be one way to try. If that sought their response, if it was a communication that was seeking some response, proactive response from them in relation to the issues that we were raising, that would be helpful. Yep.
Okay. I mean, do you want to take a week, come back to it next Wednesday?
Yeah, I'm happy to support any of the above.
Stephen?
Yeah, I think take a week then. Sure. That's
And the proposal could well be that the clerk's brief becomes our
Correspondence.
response to OFMDFM.
Okay.
Okay, thank you. So draft forward work programme, members, is at page 250 of your packs. A pause for comment.
Just in time.
If not, any other business?
Come on.
Megan, I hope you didn't come
No other business.
longer than down the stairs for this, but I'm afraid we're on any other business.
No, it's okay. I was doing media all day.
Members, there is one little bit from myself. There's a short top tips paper being prepared for all committees to help us in the use of electronic committee packs. And it's delivered by the assistant clerk. It takes about 15 minutes. And I'm wondering if we remember that next week we're starting late because of that event. We're going to upstairs. And then the next week we don't have a committee meeting. So are you content that we would start 15 minutes early on the 28th of May at 1:45 and have this 15-minute presentation on how to maximise use of the electronic briefing packs?
Yep.
Okay. And again, a reminder, we have a take note debate on the Peace Monitoring Report number 3, and that's on the order paper for next Tuesday. Okay. And in the absence of any other business, I adjourn until next Wednesday, the 14th at 3:30 here in room 30. Thank you very much.